Good morning, and thank you, and welcome to the October 2017 meeting of the Advisory Committee on Immunization Practices. We're going to dig right in with Dr. Cohen.
Good morning, everyone. For those of you who are used to hearing these meeting announcements and zoning off through them, these are a little bit different today, so stay tuned. So the proceedings of these meetings are accessible to people not in attendance via the World Wide Web. Welcome to those of you who are attending this meeting, not in person. So during this meeting, there's some people here who will assist you during the proceedings. Ms. Stephanie Thomas and Natalie Green are sitting in the back, so if you have any questions, you may ask them. So the next announcement is about food and beverage, very important. So we were unable to have coffee and lunches will not be sold right outside the room today. However, there is a snack bar with plenty of coffee and beverages and snacks that's downstairs in the basement. So you get on the elevator and you press basement, and you can get there with no escort. Additionally, during the lunch period, you can go across the street, or there is Chick-fil-A being served during lunch downstairs in the basement additionally. So thanks for, I hope everyone gets food and drink. So we would like to welcome our new Deputy ACIP Executive Secretary, Jessica McNeil, who many of you know from her previous experience as the meningococcal workgroup lead. She is also attending this meeting, obviously. And for ACIP members and liaison members, y'all will be receiving emails from her in the future. And she'll be also in charge of the ACIP workgroups. So slides of this meeting will be posted to the ACIP website approximately 3 to 4 weeks after the meeting. The live webcast videos are approximately on the website 4 weeks after the meeting. And then meeting minutes from this meeting should be available approximately 90 days after this meeting. And the meeting minutes from the June ACIP meeting should be available by the end of this week on the ACIP website. The next ACIP meeting is February 21st to 22nd. Registration opens October 27th. You can register online. For non-U.S. citizens, the registration deadline is January 24th, 2018, and for U.S. citizens, it is February 5th, 2018. So we have one guest, international guest visiting at this meeting. I don't see her right now, but her name is Hope Peasley. Are you in the audience? Are you sitting? Okay, can you please stand? Hope is the director of the Immunization Policy Section in the Office of Health Protection with the Australian Government Department of Health, and we welcome you to this meeting. And we have several member substitutions for this meeting, and they will be introducing themselves when we go around during roll call. So I wanted to give everyone a brief update on ACIP membership. The memberships of Dr. Arthur Reingold, Cindy Pellegrini, and Dr. Allison Kemp have been extended through December 31st, 2017. Nominations for membership beginning July 1st, 2018 are under review. The nominations for the members who will be starting hopefully January 1st, 2018 are waiting for final approvals. And we are holding off applications for membership. So this is beginning July 1st, 2019. And so that will be open beginning in January of 2018. So please email us at acip@cdc.gov if you have any questions about membership nominations. So public comment period is scheduled immediately preceding each ACIP vote and at the end of the meeting day. Individuals limit their public comments to 3 minutes in total. Registration for public comments is solicited in advance of the meetings. Comments not presented at the meeting may be submitted for inclusion in the meeting minutes. There are several letters that have been written and are included in the ACIP members' folders. Please sign up for public comment in the back if you didn't do so before the meeting. Members of the ACIP agree to forego participation in certain activities related to vaccines during their tenure on the committee. CDC has issued limited conflict of interest waivers for members who conduct clinical trials or serve on data safety monitoring boards. However, those members are prohibited from participating in committee votes related to those vaccines. And regarding other vaccines of the concerned company, a member may participate in discussions with the provision that he or she abstains from all votes related to the vaccines of that company. And at the beginning of each meeting, ACIP members will state any conflicts of interest that pertain to this meeting. So we have a couple of surprises at this meeting. The first is electronic. Next slide. Not electronic dancing, electronic voting. So at this meeting, ACIP members will be voting simultaneously. So each ACIP member has a little clicker in front of them, and they should double check to make sure their name on the back is associated with their clicker. We will open the voting. Members will vote simultaneously. The results will be displayed after the voting closes, so each member's name and their vote will appear on the screen if this all goes as planned. We will then verbally verify the vote, so if anybody's vote on the screen is not what they intended to vote, they can say so at that time. And if any member wishes to give any sort of comment on their vote, they can do so after the vote closes. Next presentation, I'm going to go to Pennant Bennett for.
So we have another surprise. We have a special presentation today, and I'd like to ask Dr. Larry Pickering to join us. As you know, Larry was really our fearless leader for many, many, many years, and it is a total delight to welcome him back for this special presentation.
Thank you very much, Nana. I appreciate this opportunity to recognize our good friend and colleague, Dr. Stan Plotkin, who knows nothing about this, which is unusual. Dr. Plotkin has attended ACIP meetings Dr. Plotkin has attended ACIP meetings for as long as many of us can remember and has been a constant source of knowledge and information. After many years of sharing his wisdom and guidance, Dr. Plotkin has announced that he will no longer attend ACI meetings in person. All of us have been influenced by Dr. Plotkin. Every time Stan approaches the microphone at an ACIP meeting, to offer a comment, we know that we are about to learn something, not only from his comments, but also from his sage advice and his massive insight. Honors and achievements from Dr. Plotkin are many, but I'm going to just mention a few of them. He was involved in pivotal trials on anthrax, oral polio, rabies vaccine, inventor of the RA27 strain of rubella vaccine, and co-inventor of the pentavalent rotavirus vaccine. He was founding father of the Pediatric Infectious Disease Society. He's a member of the Institute of Medicine and the French Academy of Medicine, as well as many awards from numerous societies and organizations, which I will not mention at this time. He developed the standard textbook for vaccines in 1988, now in its 7th edition and aptly titled Plotkin's Vaccines. Many of us were fortunate as being pediatricians. Well, we're fortunate to be pediatricians, but many of us were fortunate to have worked very closely with Dr. Plotkin during his 8-year tenure on the AAP's Committee on Infectious Diseases, and when he served as the Red Book Associate Editor for 2 editions, and indeed the 2015 edition of the Red Book is dedicated to Dr. Plotkin. So, to ensure that Dr. Plotkin continues to be an active part of future ACIP meetings, we present to the ACIP an engraved Stanley Plotkin knocker. And it says on it, I will read, Stanley A. Plotkin, MD, ACIP gavel. Beginning today, Dr. Pennant Bennett can ring the Sam Katz bell, and many of you remember Sam Katz when he used to attend the meeting, can ring the Sam Katz bell to notify everyone to be seated, and then use the Stanley Plotkin gavel to officially begin the meeting. Stan, at ACIP, your influence will never, ever be forgotten. Thank you.
So, Dr. Plotkin, we would like for you to honorarily open this meeting on behalf of Dr. Bennett, and you're welcome to say something if you would like, but you don't have to. You can just bang.
Well, obviously, I'm very touched. But fortunately, I did ask to make comments later in the day, so and while I'm here today, I don't plan to shut up, but since there's a 3-minute limit, I will stay within that limit. And excuse me for what I have to say, but I apologize for taking a few minutes of your time to say that this is probably the last ACIP meeting I will attend in person. I have come to ACIP meetings since the 1980s, either as a liaison member from the Red Book or as an observer. I will cease to be here after this meeting, even though the meetings are very worthwhile. The work done by ACIP is admirable and sets a standard for the world. However, although I am not yet retiring, at age 85, I may be excused for not wanting to go through Hartsfield Airport again. I will be watching ACIP on the web, and indeed, someday I may come back if and when vaccines for Lyme disease or cytomegalovirus are on the agenda. But in the way of personal recommendations, I have the following suggestions for the ACIP. Give its views on future vaccine needs, which will greatly influence how vaccine companies decide which vaccines to develop. In working groups, include more representatives of industry to offer their expertise. Even if they can't vote, don't exclude them from deliberations. Conduct more reviews of vaccine safety, which would help discredit anti-vaccinationists. Don't be shy of giving preferential recommendations when more than one vaccine against the disease exists. For example, multiple influenza vaccines are available, and there is evidence that high-dose adjuvanted and cell culture vaccines have advantages over standard ones. Finally, hold discussions about how to implement higher immunization coverage. Whatever the value of these ideas may be, I regret that I will see less of the people here. On the ACIP committee, the staff of CDC, to which I belonged long ago in the 1950s, and those here in the audience. But the toll of increasing age is inevitable, and so I close with the ancient Roman goodbye, Ave, atque vale, hail and farewell. Thank you.
Because we should do this for the first time in Dr. Plotkin's presence, I call the meeting to order. Thank you so much, Dr. Plotkin, for many, many years of sage advice. We will miss you tremendously, but we're hoping you'll just call in. Okay, I think we should start the meeting. I'd like to ask first for the members to go around and declare any potential conflicts of interest. Could we start with Dr. Stevens?
No conflicts.
Laura Riley, no conflicts.
Chip Walter, no conflicts.
Peter Szilagyi, no conflicts.
Kelly Moore, no conflicts.
Ed Belongia, no conflicts.
Grace Lee, no conflicts.
Robert Atmar, no conflicts.
Cindy Pellegrini, no conflicts.
Echezanolua, no conflict.
Paul Hunter, no conflicts.
Allison Kemp, no conflicts.
Art Reingold, no conflicts.
Jose Romero, no conflict.
Nana Bennett, no conflicts. Thank you very much. And now I'd like to have the ex officio members introduce themselves, starting with Dr. Messonnier.
Sorry, surprised me they're out of order. Nancy Messonnier, Director of NCRD, the National Center for Immunization and Respiratory Diseases at CDC.
Thank you.
Melinda Wharton, Acting Director, National Vaccine Program Office.
Barbara Moloch, National Institute of Allergy and Infectious Diseases at NIH.
Narayan Nair, Division Director for Division of Injury Compensation Programs at HRSA.
Wellington Sun, Director of Division of Vaccines and Related Product Applications at FDA.
Eric Dusing, DoD Liaison to the CDC.
Mary Beth Hand, Centers for Medicare and Medicaid Services. Amy Groom, Indian Health Service.
David Weber, Shea.
So we'll continue with the liaison members. Thank you.
Amy Middleman, Society for Adolescent Health and Medicine.
Sean O'Leary, Pediatric Infectious Diseases Society.
Pat Whitley Williams, National Medical Association.
Corey Robertson, Pharmaceutical Research and Manufacturers of America.
Carolyn Quash, National Advisory Committee on Immunization Canada.
Jeff Duchin, National Association of County and City Health Officials.
Bill Schaffner, National Foundation, National Foundation for Infectious Diseases.
Carol Baker, Infectious Disease Society of America.
Susan Lett, CSTE.
Amy Walker, Biotechnology Innovation Organization.
Scott Cyrus, American Osteopathic Association.
Steve Foster, American Pharmacists Association.
Chris Finley, Association of Immunization Managers.
Mark Natosky, America's Health Insurance Plans.
Ken Schmader, American Geriatric Society.
Chad Riddle, American Nurses Association.
Sandra Freihofer, American Medical Association. Sandra Freihofer, American College of Physicians.
Kevin Alt, the American College of Obstetricians and Gynecologists.
Susan Even, American College Health Association.
Marie-Michelle Léger, American Academy of PAs.
David Kimberlin, American Academy of Pediatrics Red Book.
Bonnie Maldonado, American Academy of Pediatrics, Committee on Infectious Diseases.
Margot Savoy, American Academy of Family Physicians.
Thank you very much.